we need to talk about something that's simultaneously well documented in research and consistently ignored in clinical practice. Women report higher rates of office-related musculoskeletal pain than men, but their symptoms are systematically dismissed, attributed to psychological factors, and undertreated compared to identical symptoms in men. The sex and gender differences are real and multifactorial. Anatomical factors matter. Women on average have smaller frames and different muscle-to-bone ratios, which affects injury susceptibility. Hormonal influences on connective tissue are significant. Estrogen affects ligament laxity and pain perception. But here's the critical part: most workplace equipment is designed for average male body proportions. Desks, chairs, keyboards, even hand tools, the ergonomic standards were developed using male anthropometric data. The dismissal patterns are frustrating and well documented. Women's pain gets attributed to stress or emotions, while identical symptoms in men prompt structural investigations. There's delay in diagnosis and treatment because symptoms are initially dismissed as psychological. Healthcare provider bias in pain management is real, with research showing women are less likely to receive adequate pain medication even for the same conditions and reported pain levels. The true physiological differences need to be understood, not dismissed. Estrogen effects on ligament laxity mean women have more flexible joints, but also less stability. Monthly hormonal fluctuations genuinely affect pain threshold and tissue sensitivity. Perimenopause and menopause create changes in musculoskeletal health, increased injury risk, slower healing, changes in pain perception. Advocacy strategies become necessary when you're facing dismissal. Document symptoms objectively. Keep a pain diary with specific details, not just "it hurts," but location, intensity, triggers, timing. Bring support to medical appointments. Studies show doctors take symptoms more seriously when patients aren't alone. Request specific diagnostic testing. Don't accept "it's just stress" without ruling out structural problems. Find healthcare providers who take women's pain seriously, and if your current provider is dismissive, it's worth changing providers. The workplace dimension compounds these issues. Equipment sizing for female bodies is often inadequate. Most ergonomic chairs are designed for someone 5'9" and 180 pounds, which is average for men but not women. Pregnancy and postpartum accommodations are often minimal or non-existent. And workplace harassment creates chronic stress that manifests in physical symptoms, but those symptoms are then dismissed as emotional rather than recognized as physical manifestations of a toxic work environment. Research gaps are significant. Women were historically underrepresented in occupational health research. Most studies used male subjects and assumed findings applied equally to women. Recent research challenges these male-centric assumptions and shows important sex differences in injury patterns, risk factors, and effective interventions. But we need sex-disaggregated data in ongoing research to understand these differences better. What really concerns me is the intersection of gender dismissal with other forms of discrimination. Women of color face even greater dismissal of pain symptoms. Lower-income women have less ability to demand better care or change providers. The compounding effects of multiple marginalized identities create severe healthcare disparities. The cultural assumption that women complain more about pain or are more sensitive to pain isn't supported by evidence when you control for actual pain stimuli. What research shows is that women report pain more accurately while men tend to underreport, and women seek care more appropriately while men delay until conditions are severe. But the medical system interprets accurate reporting as exaggeration and timely care seeking as excessive healthcare utilization. The solution requires both individual advocacy and systemic change. Women need to advocate assertively for their health, but they shouldn't have to fight this hard to be taken seriously. Healthcare providers need training on gender bias in pain treatment. Equipment manufacturers need to design for the full range of human bodies, not just male averages. And research needs to include women as subjects and analyze data by sex to understand true differences rather than assuming male patterns apply universally.